Good morning, everyone. So we will start out immediately, and I think a lot of people are waiting for this talk of Dr. Sabapathy. Why I am confident that burns is the future.
Good morning to all of you. Actually, when my son he put the program, he said, I have to give you a difficult topic, and I also have to give you a topic at the time, when nobody will come. So it's a Sunday morning first talk you have to do. So yes, the topic is why I think that burns is the future. And though he has given the topic, I strongly believe in it because I've been frequently telling that to everybody in our unit. It's quite a difficult topic. The atomic scientist Neil Bohr, when he made the model, he said prediction is very difficult, especially when it's about the future. But we always keep trying. And just before this talk, when there are a lot of people smiling at this topic, I said, I wish someone plays this talk, recorded talk 20 years later, and find how much I've been very close to my prediction. Future, I think, for whom am I talking to? I'm talking for a surgeon who is 30 or 35 years old. And if you ask a surgeon who is 35, I think what does he want? He wants a job security, he wants a good compensation, and possibility of scaling up in perks, both in perks and job challenges, and a good work-life balance. And if you really ask them, I'll ask a lot of people, and then the last one, they put it as loving what you do and do that well. But I really wish people put this as first. If you put this as first, I think the other four automatically comes in. I think that's what I very strongly believe. And where is the future? So if you analyze the scientific things or the products that they have come, you will find that either you must be a solution for an unmet need. I think there's a great need in the society. I think you must be able to meet that need. That's an unmet need, that's one. Or people may not know they need it, but then you introduce the need to the masses. For example, what Steve Jobs did with iPhone, what Sony did with Walkman. So nobody thought they should have a Walkman, they should have music in there under the belt. And nobody thought they should have a camera in the phone. Nobody thought. But then they introduced the need and made everybody jump at it. So either you must be a solution for an unmet need, or you must introduce a need and make the whole of the people accept it. Whereas burns is an unmet need. But then if you want to do the other category, you have to be an amazingly big guy. But then why burns, I say, is unmet need is because outcomes that in India are far away from what is possible in the best centers of the world. That's one. Not only in just matters of survival, quality of life after survival, integration into society, on all parameters, it's there. And this is in stark contrast to every other field in medicine. So, what will make a difference is that a person who is passionate about it, and if you want to define fashion, I think what is passion is that you need to be willing to suffer for what you love. I think that's what you define fashion is. But then if I'll give a lot of examples as to find how the other things which we now take it for granted have been when we started. So when we were training in plastic surgery, 83, 85, so at that time this was the book we read, Converse, that's a book. And there was a volume on microsurgery, and we are all told, no, you don't have to read this volume. So they said, no, you don't have to read this volume. But then some of us who are very interested, I think, read that volume. I thought, no, we are in the future. I think all those fellows who took microsurgery at that time, they established big units. You find the world embraced microsurgery in the 60s and 70s, and we embraced it in the 90s. You take a brachial plexus surgery, which is very big now. I think Hari was there when he started. All of us, many people said, you will remember that with a lot of trepidation we started. I visited Singapore at the time. There was a conference just to know what it is and if it's worth getting into. So at that time, they really didn't think of a future. But in 2022, last year, we had 502 brachial plexus related surgeries in our unit. I think that's a huge number. So if you just think about 20 years ago, where we were and what we thought about it, it's a big number. Same thing about diabetic foot. When we started diabetic foot, in fact, we really wanted to make it as a difficult wounds clinic. And most of them became diabetic and diabetic patients. And we expanded with interest. We studied the subject, skilling ourselves. Now, it's one of the key components of our work. I think last month we had 123 diabetic foot related surgeries in a month. And we find that 28% of our ICU admissions or HGU admissions were of diabetic foot. And same thing about on-arrival block. When we started it, we gave this block and nobody thought it will become big. Now, I think it's now becoming a standard of care which every other big unit wants to embrace. So all of them, when they started, they were all now very small, but then what it really required is that now you need to continue it on. If you really take burns, what puts everyone off, the young person off is that high mortality and excessive cost, and people say people can't afford it, it comes to the poor and all that. And you continuously keep working at it because of the poor results, you get burnt out, and it is quite boring. I think way to go is not to worry about it. You need to really change how you look at it is what is very important. If you really see that I don't want anybody to become a pure burn surgeon. So when we started, I didn't start as a hand and microsurgeon. We started as a hand surgeon with a special interest in plastic surgeon with interest in hand surgery. Then my brother started with orthopedic surgeon, interest in spine surgery. So everyone has to be like that. Suppose if Hari takes it, he is a plastic surgeon with a special interest in trauma reconstruction, a plastic surgeon interest in craniofacial surgery. I think that's what will work. I think we are only not asking a burn surgeon. We want a plastic surgeon with an interest in burn surgery. That's the way to go. So this is one of the slides which I like, which comes from Arvind Hospitals. And they are one of the pioneers in the eye care system. And their executive director, when he spoke to us in one of those meetings, he said, probably everything what you take is the perspective that what is matters. There are a lot of things like problem, design, and impact. He said how you view the problem influences the design. Design means how you plan and go about it. It's not the designing things. And how we design influences what we do. And what we do impacts the problem. So I think that's the way. Problem, design, impact. I think in everything that you do, how you view the problem, that influences design, and then how you design influences what you do, and what you do impacts the problem. So in fact, what the impact that finally you do, I think it all matters to the perspective. It's all about perspectives. So the only requirement I would say is that somebody who thinks positive. I think the requirement for a successful burns unit is that I don't worry about the equipments and all that. They are all easy. That is most easy. And the only thing is that he must have some leadership qualities. I think that's what it is. You must be skilled in this job. I think you must be willing to work hard. You must be an inspiring storyteller and ability to learn, form a team and lead it, and continue to do it no matter what. So people say about funding, I think I'm least bothered about funding. Personally, I feel money is the easiest thing to get, provided you really are keen in doing things. And I'm sure the law of averages will work. If you do good things, I think how we built up our unit is, the hand surgery did not develop just like hand surgery to people. So we started doing successful replants, and then people thought, oh, if these guys can put a totally amputated hand back, then a lot of fingertip injuries came in. So I always used to keep telling that microsurgery will get you a lot of non-microsurgical work, and it's the non-microsurgery which sustains microsurgery. I think microsurgery you have to heavily subsidize. Similarly, I think in the very beginning, I think if you are able to have some success in major burns, I think that will get you a lot of minor burns, and minor burns will have to keep the major burns going. So what it makes to be certain is that I just give an example. I think you need to put in effort. We see a lot of young doctors now immigrating to America. They go it after their MBBS they go. And if you see their career pathway, they all work like dogs. They work really, really, really hard. I just keep telling them, if you put in the same effort that what you put in America to get into residency, get into specialty, and then become attending, if you put that same effort for so many years, I'm sure easily you'll reach the top in India also. So you can easily become a star if only you take up a field where there is a need, but then no one wants to go there. So when we started, nobody wanted to really go into microsurgery. They thought it's a non-starter. It's not going to work. In trauma, nobody wanted to get in trauma in private practice because they said all the fellows who get injured are poor. Somebody gets injured, somebody else has to pay. ESA is there, government is there. So a lot of arguments were there. So my roadmap for becoming a good thing is you need the surgical skills and knowledge in intensive care. Just to stay in power, I just put it off as what Peter said, just get in. One just get in, the next is just never give up. I think that again is very important. This was given up by Bhaskar Bhatt, head of the Titan group. He gave us a lecture last month. And making it into a $1 billion company, one of the things he said was never give up. Third thing is what I try to young people is that it's a field without any competition. I think it's a field without any competition. In India, rich follow the poor. So Justice Shivraj Patil, former judge of the Supreme Court of India, when he was here, we asked him to talk, and seeing a lot of things what we do, he said, this will really work because in India, rich follow the poor. And burns, one of the important things is that once a burns patient, yesterday somebody was telling, once a burns patient is always a patient. So it self-generates load for the future. So now you will have a burns, then after that they'll have for contractures, they'll have fat grafting, they'll have a tissue expander, all that you would do. And secondary surgery in burns, people sometimes think burns is not interesting. In fact, to do good burn surgery, you require to be you need to be an extraordinarily good plastic surgeon. It's a very high-end reconstructive surgery. It needs more skill than most of the surgeries. COVID or not COVID, recession or no recession, you'll never be out of work. See, if you have a patient who has got a hand like this, that is his left hand and that is his right hand. I think if you have two bad hands, and if you have to make him work like this, if you have to get back, he's doing all his activities. He drives, he does, now he's an entrepreneur. If you have to do this, I think you need more skills than doing a replant. I think replant, I would say that is about, it only requires 50% of your effort than what you would do to get this in. If you want to do this ear reconstruction, a burn in a patient who has got a scarred skin, if you have to put it, fabricate it into the forearm and then take it to your ear, then that requires much more skills than this. So it's more exciting, it's more challenging than what you would do this. The next thing I would say is that hereafter, I think the distances will shrink in India. I think that's very important. I think people will be willing to travel provided good healthcare outcomes are available. So, for example, if we are doing about 500 brachial plexus surgeries, it's highly impossible for us to have so many brachial plexus patients happening within even 200 miles of radius of Coimbatore. That means we need to attract patients who are about 1,000, 2,000 miles away. But then how do they come? Because they'll feel it's worth coming provided we give the outcome. I think it's just a chicken or egg story. So you feel good outcome you give and then you get the patients. That's it. So hereafter distances will shrink. I think I'm absolutely sure. And people will be willing to travel if good healthcare outcomes are available. The next is this, an expanding industry support. See, previously I don't know whether in a burns or not. If you do hand surgery, as far as the trauma hand reconstructive surgery, I think it's extremely difficult to get industry support. For example, a fellow gets an amputated thumb. I don't use anything from industry. I use his own thumb to replant. What is the industry component in there? Nothing is there. Whereas right now, I find that in the burns, there is an expanding interest. There's so much of things, skin substitute, wound care products and all this come. So I'm sure it's going to be an easier and a better field to do it. And more important than that, I find that the people open up their purse and then NGOs, they are happy to do it for burns than for any other small industries. Next is that I find that government is also found. I think you had a chief guest coming up from the government. In fact, they sat and listened to what we are telling because they found that all the verticals that I have in acute injury, they found that the burns vertical is the one which they have not been able to do anything at all, and then they're just wondering what's happening. So now a sort of awareness and enlightening has also come up to the government, and they are not that they are wondering what to do, they do not know also what to do. I think that's the most important. They really don't know what to do. So when at this stage what we need to do is that we have to become a very proactive participant to them. So I finish off with this slide which we always take is when Shakespeare says, Caesar, there is a tide in the affairs of men which taken at the flood leads on to fortune. Omitted all the voyage of their life is bound in shallows and miseries. On such a full sea are we now afloat, and we must take the current when it serves or lose our ventures. So I think it's an opportunity. I think you should really think, if you take that as an opportunity, that's fine. Otherwise, you say, you keep on telling about the negatives part of it, I think it will be, it's not going to, it's going to win. So whether we recognize the tide as an obstacle or an opportunity, I think that's with us. I think I think for the younger persons also, that's the same point. In other fields, there is so much of competition. If someone has to become a good hand surgeon right now, I think it's very difficult. I think you really have to make a mark, because there are so many bright people coming up. If you take an orthopedics, someone has to take a spine surgery and then really become a top-class guy. I think it's very difficult because all the brilliant fellows, they are all going to the arthroscopy, spine. So I think they are all getting saturated. So the question is, whether you take an obstacle, whether you see it as an obstacle or a difficulty, or you perceive it as an opportunity. I think that's with us. Every guy who has seen such problems as a great opportunity, I think they have won the game. And I think burns is a field that's an open opportunity for a very willing, intelligent surgeon. I put this, very willing, hard-working, intelligent surgeon. It's not for a non-starter. No? He must be a willing, intelligent surgeon who wants challenges to work and make life meaningful. Thank you so much. And I think 20 years later, we'll find how this works. Thank you so much.